This is the Emergency Medical Minute, sponsored by Health One. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
Okay. So some of you may or may not seen, but the CDC recently came out with some new guidelines for the treatment of gonorrhea, which is the first time in probably about 10 years that they've really made any updates to it. Basically what they're finding is that we're getting increasing resistance with Rocephin and with Azithromycin. So the new recommendation that we'll be adopting soon is for treatment of gonorrhea, specifically on its own, is 500 milligrams as an IM injection. If the patient's greater than 150 kilos, that'll be a 1 gram IM injection. Interestingly enough, if you're treating empirically, because the resistance to azithromycin is so high for for gonorrhea, they recommend empiric treatment to be this 500 milligrams of IM Rocephin plus a 7-day course of Doxycycline. If we know that the patient just has gonorrhea, we can do only Rocephin. If we know that the patient just has chlamydia, we can do just the azithromycin or just the course of Doxy. Unfortunately, we rarely know that. So going forward, the recommendation for empiric treatment will be this course of Doxycycline for 7 days and then Rocephin IM. They also came out and said, in addition to that, some alternatives that we can use, Gentamycin IM, which has been available to us, that will go along with a 2 gram dose of azithromycin. And then previously they had tried to get away from oral Cefixime just because the resistance rates were so high. They said in the absence of other options, or if patients are truly unwilling to get an IM injection, then we can do Cefixime, but they did double the dose on that, so that would be a one-time dose of 800 milligrams. Again, they don't recommend using that as first-line therapy, but that is an option. They also talked about for if the infection is in the pharynx, that they found that resistance rates were too high to the gentamicin and the Cefixime, so their only recommendation was this 500 milligrams of IM Rocephin. They said if the patient has a significant allergy that you need to delve deeper into it, and then if there really are no other options, to consult ID for those ones. But for all other ones, that's okay. So we will be working on updating the order sets for this kind of across the division. We are looking into local resistance of azithromycin for chlamydia as well to see if we do need to adopt this empiric change of using that 7-day course. Obviously the concern there is patients go home, the result comes back, and they only have gonorrhea, then there's no reason for them to be on a whole 7-day course of doxycycline. Obviously that's just going to contribute to the resistance. So we are looking into that, but for right now this is the guidelines that the CDC has put forth. It is, yeah, the Gent is a one-time dose plus a one-time 2 gram azithromycin dose. So that would be an option for patients, especially if they have allergies.
Hello, EMM listeners. We are dedicated to providing you with high-quality educational content free of charge and without ads. As a nonprofit organization, we rely solely on donations. So if you enjoy our show and are able to make a one-time or recurring donation to help cover our operational costs, any amount is helpful in making this show possible. Click the link in our show notes to make a donation. Thank you.